ILC's newly published report, The Invisible Epidemic, Rethinking the Detection and Treatment of Structural Heart Disease in Europe, comes at an important time when governments are embarking on structural, economic, and healthcare reform in light of the COVID-19 pandemic. Our report, which has been informed by key expert stakeholders, finds that for too long SHD has been overlooked, despite the condition already placing a heavy burden on our older population. In 2020, it was estimated that 14 million people in Europe were living with structural heart disease. But we know that the current commitment levels by national government and across the EU to tackle this disease are still not enough. And without swift action, this burden will continue to increase. Indeed, by 2040, the number of people living with SHD is expected to increase by 43% to 20 million. While untreated SHD has a high mortality rate and it can severely impact the quality of life for those living with the condition, if caught early enough, it can be treated. Yet suboptimal detection and treatment continue to persist, resulting in unnecessary health and economic costs to society, in particular placing a heavy burden on healthcare and social care systems. Some of the barriers we've highlighted in our report include widespread lack of awareness about the condition among the public. For instance, even in the Netherlands, which has the highest levels of awareness in Europe, we find that only 12% of the population aged 6 years or over are in fact aware of structural heart disease. In addition, our stakeholders are particularly concerned about the lack of awareness among primary care physicians. A big issue is that both individuals and healthcare professionals often dismiss SHD symptoms such as fatigue or breathlessness as usual signs of aging. Underdetection is also a problem. A simple heart check with a stethoscope can let physicians know whether there is an abnormality, and they can then refer their patients on for further testing. Yet only 1 in 3 Europeans aged 6 years or over report having their heart checked occasionally, and just over 1 in 4 have their heart checked at every visit. Other barriers, such as unequal access to the right treatment options, means that many are left living with the condition. Unclear pathways to treatment and clinical guidelines, which aren't adopted as a gold standard across European countries, are also part of the problem, as is lack of systematic and harmonized data collection across Europe, which makes it difficult to measure inequalities in detection and access to treatment. And of course, we must not ignore the pervasive ageism at the policy level, at the healthcare system level, as well as ageist assumptions held by individuals themselves, which are a main contributing factor to many of these barriers. Some of the key recommendations that ILC calls for are for governments to launch awareness campaigns to better educate the public as well as healthcare professionals. We must also create clear care pathways for treatment, which includes building specialist centers with trained multidisciplinary staff where all SHD patients can be treated at. We must make it mandatory that older patients have their heart checked annually. We must also ensure that there is strong political commitment and backing from national politicians to address the SHD burden. We must use technology to improve detection and treatment options, and we must be better at collecting data to understand who is most at risk. And finally, we must continue to dispel ageist stereotypes that are preventing many people from seeking treatment. If we take action now, we will be able to tackle this silent epidemic.